What's up, everybody, and welcome back to another episode of the world's top-rated podcast, the Bulletproof Dental Practice Podcast. And we have a very important podcast, almost like a PSA, public service announcement, because this is just such a pain point in all of our lives. And I'm hoping that every doctor that is thinking about hiring an associate and every associate that's looking for a job, make sure you like, share, and save this episode for future reference. It is a game changer. It will be a game changer for everything you think about what you think you want. So we're very lucky to have Erika back on the podcast. And if you don't know Erika, she's a total badass. She's not only the office manager here at our practice, but she runs and works in different practices as well. She actually helps out Peter at ADS, and ADOM gave her many special distinctions and she has a lot of acronyms behind her name. So without any further ado, if you don't know Erika, you're in for a real treat. Erika, welcome back to the pod. The crowd is going crazy.
I'm not sure that goes through, actually. But.
It doesn't matter. Well, if you didn't hear that, Peter has a little keyboard where he's making sound effects. It's very nice. You can do like a wah, 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 wah. So Erika, you are the front-facing person now that's dealing with, you're seeing all the things that Peter and I have been seeing for a long time. It is so disconnected. So this podcast is literally swiping right, how to find the perfect associate. What are the things you wanted to ask? So jumping right in to the mix here. The first topic is that the economic expectations, people are coming in, these associates are coming in, and there's a lack of economic alignment, between percentages and what they want to make. So if you don't mind, jump right in with that, what you're seeing.
Yeah, I'm actually going to take a play from your playbook, Dr. Craig, and I'm going to wind back a little bit and talk about the bigger picture here before we jump into the tactic. And, really what we've seen at our practice, we've gone through so many failed associateships. We talk about, you joke a lot about the graveyard of associates, and I think it's close to 100. You can correct me there, if I'm wrong, but quite a few.
It's definitely not bad. I like the idea. Okay. Never let the truth.
It's a weird badge of honor, by the way.
No, well, listen, no, it's actually 20. It's 25, but of total
100. She said
it's a lot. It's a lot.
But by the way, I got to defend myself here. And I know where Erika's going with this, because had we had this information ahead of time, it would have been half the number. But people move, people get married, people move on. It happens.
You would look like my practice then.
Yeah, it's all good.
Yeah.
So go ahead.
It's a lot. And, as the office manager coming into the process of hiring and onboarding associates, there's a lot of things that I've learned. And one thing is, as we know, communication is honestly more of an art, because as a tactical person, very logical, literally what someone asks, I will answer exactly to the question that they're asking, but not reading in between the lines is what they're really trying to ask me. And this is kind of the spirit of having this conversation, because we've recently had several interviews for an associate, and I feel like we got even better. We landed on a really great one. So we'll see how that transpires, but getting better at identifying the actual communication, the actual questions that a practice owner needs to ask, but then as an associate that you need to clarify and you need to ask, because I think we just assume way too much by what we mean. And so that's the spirit of having this, is to ask better questions so that we get a better fit the first time.
And I want to add one thing that, Erika, just before you jump in, there's a saying that a friend of mine says a lot. He says, clarity is kindness. Clarity is kindness. So if we're really being intellectually honest, when we have a failed associateship, we were partially unclear. We weren't clear. And then we had to have corrective after corrective conversation, and it eroded the fabric of the relationship. So clarity is kindness, understanding. And what Erika's talking about is she's our first principled thinker. Okay, this person's asking me this question. What are they really concerned about? What's their fear? What's their motive? So jump right in if you don't mind with that one.
And also, can I just comment too? This goes back to something that I feel like our industry has brainwashed us to say, right? We get hung up on the percent. Tell me the semantics of the percentage and the this and the that versus, like you're saying, Erika, just show me the outcome. Like what is my potential here? What's your fee schedule? Things like that. I know I'm maybe jumping ahead, but I think when you opened this pod, you said, jumping right into it, it's usually the compensation kind of thing, right?
That's one of the first tripping points. Yeah.
Yeah. And Absolutely. So on this slide, we presented in preparation, we did some research here in 2024, the salary. So there's the average associate ranges off between 138 and 400,000 for a full-time associate. And so the average associate income is about 217,000. And then obviously a higher percentage in a low performing practice will yield total less income, right? And something like we're like a SPODAC environment where it's like high fee schedules, high collections, high new patients, things like that. But yet that's not the questions that are being asked. So Erika, proceed. I just wanted to kind of set the stage there.
Absolutely. So fail number one when it comes to compensation is the practice owner, whoever's doing this process. So if your office manager is, please make sure that they're listening. Is then they answer the question by saying, yes, this is the compensation formula. This is what we're offering. Here's the daily, here's the percentage and your percentage of labs. And they leave it without the additional context. They leave it for the associate to then interpret and do their own math based off of what they think your practice is generating. And so what we have also found, especially in our practice, and yes, lots of things go into the opportunity, and that's what we're talking about, the opportunity and potential for you to have a higher earning is not apples to apples, practice to practice. So 32%, let's just say random number 32% of a higher performing, higher opportunity practice will actually yield more in take home than 35%, 40% of a lower opportunity, lower earning potential practice. And that matters because ultimately we all have our number in our head. And so we just skip to the percentage and we don't talk about what do you want to take home? Because then we can reverse engineer and we can show them that they can actually take home that income or more with the compensation package that we are offering.
And also potentially working less. So we've
working
had
less hard.
How about
working
less hard or seeing less patients or less volume?
Yes.
So if you get 50% at a practice that's, let's say HMO Medicaid, and you're seeing 7 patients at once, and you can generate $1 million a year, wouldn't you rather go to a practice that you can generate 1.5 or $2 million a year, seeing a third the volume? So the problem that we're seeing is that doctors, and sorry, I know you want to say something, but doctors only evaluate, the associate only evaluates this. No one actually comes in saying, hey, can you show me what your top performing associate doctors have done? Strike out the name. I want to see a collection report of the 2 or 3 associates you've had or have, or what do you even do, doctor? What do you do? Because if no one else is doing 500 or more, you're going to come in there and do 1.5? I doubt it. So that's the question that no one's ever asked us. No associates ever asked.
I was almost fooled by that. I've never told you this story, Craig. Coming out of dental school, before I decided I wanted to come back to Atlanta, I almost took a job in North Carolina, and I was enamored by the high dollar amount this guy was promising me, and knowing nothing coming out of school, I met with him. I think it was at the time. So granted, this is 25 years ago, so the numbers were different, but it was guaranteed like $180,000 base, which was giant, right?
Amazing.
Come to find out, and I was almost ready to pull trigger because I didn't know what questions to ask. Well, this job was 6 days a week, 10 hours a day. 9 hours a day, right?
It's like in a clear choice doctor. It's amazing revenue, but if you see your percentage, holy smokes.
Yeah. So it's there's like, Eric, I love how you were saying, like, let's start at the end and reverse engineer for that outcome, based on, right? Because everything's different in every practice. And Craig, I love what you're saying. Like, let me see some reports. Like, where has this worked well in the past, right? Or am I just an experiment, so to speak? And
right.
Doc, let me see your numbers.
Am I your first associate ever? Okay, that's fine. What do you, owner doc, do? Oh yeah, I work 6 days a week and I do 600 grand. And I've been doing this for 10 years. Are you really thinking you're going to come in there as a newbie or a 5-year person out and exceed the owner in the first year? So even if that doctor wants to give you 80%, I don't know if that's going to work. Erika, sorry, she's turning it to guest listener.
Guest listener.
No. I think it's all valid. And I think these are great points, and just to what you guys are saying. So if we give some tactical advice, practice owners, when it comes to compensation, the first question has to be the take home, not the percentage. And then once you get the take home amount, now you fit in that percentage that you're offering and align it with the take home, if that makes sense. As the associate, how do you do this? How do you assess the opportunity that you have in the potential practice? That's going to be, the willingness of the owner to share those numbers, as you guys were discussing. If they're unwilling to share the numbers and, what other associates, if they have any, or the doctor, that would be a red flag to me if they're not being able to share some of those insights. So very important to do. I think in context also to the financial and the personal situation that I went through, and I had this aha moment recently, was typically associates will ask these questions. So percentage, they're going to try to do the math themselves, and they're going to ask for the fee schedule because they want to also see that opportunity. And then they're also going to be asking for, obviously, the number of days, the number of patients that they're going to be getting, your typical reimbursement rate, percentage, and participation with insurance. So some of the very tactical questions that ultimately leads to, again, the take home amount. And this is why this matters, because it's almost impossible to try to do your own math in those scenarios by asking those questions. And you can certainly ask for that information. That's totally fine. But that's where I found this realization and that aha moment. It was not really about those tactical things, but it was just really about guaranteeing that they could make a living. The other thing is
they don't
so many things get
that.
stopped, you guys. And I'm having a situation like this in real life right now with someone that I'm kind of talking to, and it's a semantic thing, right? Mm-hmm. Like you're getting stuck. So many things the dating process has been stopped between associate and owner simply because of percentages. And you're arguing about something that really means nothing in the context of the outcome.
Well, right? It has some meaning.
Well, that's right. It's just not nothing, but it's not something that it stops a lot of conversations, Craig, is what I'm saying.
Let me just say one thing. I've been interviewing associates for 20 years, right? Mm-hmm. I've never had an associate. I'm sorry?
The graveyard.
Just saying, I've met 20 years worth of them.
At least.
No, it's 1 million. It's actually just checked. I checked in my Dentrix and my Abacus, because when we first started, we used an Abacus for our PMS. So listen, I've been dating or looking for these associates for 20 years. I've never had one associate in my entire career ever say, "Hey, how is the business performing over the last 3 years? What has been your annual growth rate? Is this practice growing or shrinking?" Don't you think that is a paramount question to ask a doctor owner? Hey, what has been your what's your annual growth rate? Well, actually, the last 4 years have been really bad. The factory closed down and our practice has shrank by 15% every year. We are down 62% over 3 years. But I'll give you 80% of what you do. Hell no, you're riding a freaking sinking ship.
Yeah, like how do I know I'm going to be paid? I mean, we've heard instances where that happens.
How come no one is asking that? So an associate, ask the question. If the doctor says, "I am not sure how our practice is doing," there's and again, I want to just take one small tangent. Patrick Pitt-David, who's very influential to Erika and then through me, because she's and also Peter, you both really are big fans. He says this thing about solopreneur, entrepreneur, intrapreneur. And an associate at its core is an intrapreneur. He's a person or she's a person who creates their own opportunity within the confines of a structure or an entrepreneur. But I'll tell you what, it's really hard to make something special when the organization is crumbling around you. It is better that you hitch your wagon to something that's growing and you try to grow within that. But, if your owner doctor, if the doctor that's interviewing you cannot speak to whether the practice over a 3-year trend is growing or dying, that means you're not working for an entrepreneur, because every entrepreneur knows their numbers. You're working for a solopreneur. You're working for a doctor that just has a job. So that's a tell. If I say to Peter, "I want to buy into your company," and he says, "Yeah, that's a good idea. We've done 17.8% growth and our profit is expanding by 24% year over year." This guy knows his freaking numbers. So sorry, go jump in, Erika, on that.
Yeah, no, I think that's all relevant. And, these are the questions that we don't ask. The other thing is we don't talk about this either. And I think that we've even done in our practice, we haven't done enough at creating the value for what sets us apart from practice to practice. So we know this. How are we communicating to our associate that we do have our shit together, that we are a thriving business, that we are sharing the numbers, even when they're not asked? So this is kind of, again, the spirit that goes back to it is we have an ability to almost to communicate, but to present information that is relevant, that people are looking for, that they're not properly communicating. And this goes back
imagine
to
the why join us with pie charts. Why join us? Average tenure of associate blank years, average job satisfaction 5 years, best place to work award, growth of the practice 46% year over year. I mean, imagine if we gave that, like, why us? Why choose this opportunity? The DSOs are doing that. They're giving, when the DSO, when they get an offer at Aspen or Pacific, it's pretty slick, the packaging.
Absolutely. Now, I'll also tell you what's worked in our favor is, a lot of times, yes, we talk about money, but before we even get to that point, so once we have the associate, they've given their resume, we've taken a look at some of the dentistry, we had like kind of a call just to see if we're vibing with their communication style and, their personality. The associate thing is invited back in, and they do multiple shadowing days. And this is kind of assessing for a cultural fit. And I think what works in our advantage is because we do the cultural process almost first. And then once we decide we like this candidate, then we start the talk about compensation. And that really does enhance, in the practice owner's favor, really, actually in both, it makes it easier because now they already have that value. They've experienced it in your practice because they've met the team. They see the patient flow. They look at your schedule. They see how it's run. They're asking questions. They're seeing the quality of the dentistry. And it's not so much of believe what I'm saying. It's see it, live it, experience it. And now when we come to the table where we're negotiating and talking about some of the harder things or the numbers, it's so much easier because you have that trust.
You've taken a test drive. You're not just like looking at the Mercedes and then going with it. The other thing is really that culture too. Like if you have a disruptive culture, if I was an associate, I would gladly shadow. And by the way, this is what we're dealing with in our mastermind. Our masterminders are saying, hey, this associate, I want them to shadow. And the associate's like, yeah, but you have to pay me a daily minimum guarantee for me to shadow. So I need to be paid to see if this job is a good job for me. I don't want to waste my time. And if I wind up working in a practice that I know nothing about and work there for 3 months and it sucks and I have to quit, not only does it look bad on my resume, it's friction, it's stress, it's hard. Even it's not easy to just undo your job. It's not like you bought a shirt and you can return it. You actually have to wear the shirt for 3 months and it's a big commitment. So if it was me, I would say, hell yeah, I'll shadow, but I am going to do it on my own terms. I want to ask Becky, the hygienist, how is it working here? What are the good and the bad? I'm going to ask the other associates, even if there isn't an associate, but there's an old associate, can I get that guy's number, that girl's number, and can I ask him how it was? And I'm going to actually say, how much were you able to collect there?
If someone asked me, I'm just going to be quite honest with you. If an associate asked me to comp them for them to come in to shadow, it'd be a non-starter for me.
Mm-hmm.
Well, I mean, it's kind of, I leave it back on us too.
No, well, okay, but that's super myopic of them.
I understand, but if you handle the conversation the way we're talking about it and they ask, that would be offensive. But if you handle the compensation like, okay, I read your resume, you get 32%, it's a $550 minimum guarantee, and we're ready to start, but would you like to shadow? Like you set the tone as a transactional relationship. It's incumbent upon us as the business owner to create the value.
That's why the culture piece happens first, not the financial piece. So you've already got to the point after the phone call and the resume to say, okay, this person has enough qualifications that we want to learn more about them. Let's go on a date. Now we invite them in the practice to meet the team, check out the dentistry, evaluate our culture. And it also allows us to see how they interact with the team, because there have been times where we've had people come into that phase and it was a non-starter for us because they come in and they actually, in our favor, showed their true colors in poor communication or, disparaging comments.
Disparaging.
Or even telling the team, look, we can't ask people certain questions as employers. There's certain taboo subjects, but like our team can be like, so what's the deal? Like, what's the deal? What are you doing on the side? Like, oh yeah, I'm a stripper on the side. Okay. Well, that's probably not a good, may or may not be a good thing. I don't know. I'm just saying, like, there's things that the team can report. So we actually have this democratic process where before we hire someone, the team has the voice to say that's a good person, because they have different conversations than we do.
What's interesting, though, you guys, is that in our industry, I would bet you that 90% of associates been hired show up for their first day of work without having met anybody.
Without anybody. No
and
one
it's
knows
like,
them.
hey, meet your new person that you're going to work with more than you're going to see your family.
Your arranged marriage.
Yeah. And it is, I agree. So like, if you're an associate wanting to go work somewhere and you don't ask to do a shadow day pro bono, so for your own edification, shame on you. Secondly, if you're hiring and you don't get the consensus of your team, an assistant that's going to work with that person and all these things, then shame on you, because this is setting it up for failure, right? And like Craig, you're saying, there's a tremendous amount of friction when these things unravel, which most times they do, we've found in dentistry, right? 56% of associates are currently looking for other jobs right now. Okay, so these things are...
Yeah, and I will say that...
Yeah, go ahead, Erika.
Yeah, I will say that, I mean, the success ultimately of the associate isn't their own ability, it's their ability to connect with the team, because the team is also spending more time with the patients, accepting the communicating the treatment that was diagnosed, validating that treatment, presenting the treatment, performing the treatments, and a lot of times having the initial contacts with the patients before they even see the associate. And if you don't have good rapport, or if you're not vibing in that organization, that absolutely dictates your outcome, not having the ability to communicate properly with your team or their team.
So important.
So that
the downfall, I think most downfalls
Absolutely.
probably happen with that regard, not meaning over time, like just a non-compatible humans. You know what I mean?
I would say it's
incompatible.
Equally, I think it's equally split, Pete. I see people that are highly productive, great with the team, or fine with the team, but doing poor quality dentistry. And I see low dentistry or great dentistry, but can't connect. It's all of it. You have to have this trifecta. You have to be good at what you do, good with patients, and good with your team. You must.
Yeah.
And any one of those.
It's like when you're dating to try to find like the perfect, like the 6'4" guy who makes this, anyway, you're searching for unicorns, right? Because of like someone who produces high is good with my team. It's very, very challenging. That's why I always say, if someone comes along in your life and they are guns blazing, they are perfect cultural fit, but you don't have the exact layout for them, figure it out, because rarely do the perfect people show up on time when we are ready in our life.
Yeah. And when the person shows up, the people in our business is the hard part. So I don't think of buying a practice and then finding a person. But if I find a person, I'll do anything for that person.
I'll build them an office. I've told that. I mean, that's
no problem at all.
Yeah. Okay.
Absolutely.
So the next thing, go ahead, Erika.
Go ahead. Well, I was going to say the next thing is alignment between what you're wanting the associate to do, like your expectations, and having a conversation about that upfront, not only in the skill set, what you want this associate to do clinically, also longer term. Are you wanting to hire an associate to eventually buy your practice, partner in the practice, have additional associates, have a different locations, and disclose that up front, because you want to make sure, again, that if this person is your person that needs to be a bigger part of your big picture, does that person want that too? That has to be a yes. Otherwise, it's going to lead to a lot of wasted time. And then treatment philosophy, the approach to your treatment and what you want to provide to your patients. And in our office, part of where some of the associates have failed is that we are constantly striving to provide better quality, higher levels of dentistry. And we do a lot of coaching. We have a lot of doctors here with different levels of tenure and outcomes and results and multi-specialty. And we want associates to embrace our drive and commitment to continuing education. and then also to be coached and mentored. And in our reality, not all of the associates are like that. And some of our failed ones have come from them having a fixed mindset and not wanting to grow anymore. They kind of felt like they were arrived. And what we know is technology changes. New things come out in dentistry where we can provide better services, faster, more efficient. And if we have somebody that's already resistant to change, we want to identify that in the beginning. And those are some key things to make sure that you're having those conversations. I find that for the offices that I've coached that are looking for associates, they stick to the typical questions, which is just strictly financial. Do you have a degree? When can you start? Number of days, number of hours, and they skip over all of the soft stuff.
Everything I think else. A big one is the clinical alignment. So in our practice, we have a mock presentation of 3 different mock cases. And it is amazing in my tenure to see one person's FMR is another person's like whitening trays. One person's 4 root canals and crowns is another person's like, Invisalign, and watch those areas. So the variability when you're hiring your first associate, dentistry is a siloed cottage industry. And we all go off, more than 60% of us are solo practitioners, and we develop a very bespoke way of treating patients. And you assume that this Dr. Newbie that went to, school 5-7 years ago is going to be exactly like you. Just it is a great exercise to sit down on a computer with your charts and open them up and say, Doc, what do you see? And you will be shocked at the treatment philosophy. Nothing breaks up an associate faster than the new doc coming in and recommending treatment that the senior doc does not agree with. That relationship is screwed quick.
For sure. I think this is one of the smartest things that you do. And I did not implement that many years. And I got very lucky just having.
Well, you didn't get lucky. You had a very interesting system. So for those that don't know it, Pete had a clinical director or a person that was really tapped in, Dr. Curry really tapped into the residency and nothing. You had 2-year working interviews, Pete.
That's
you just didn't know it.
Right.
So for 2 years, you get to know that guy or that girl is amazing at what they do. They're going to be ready to roll out in June of 2 years from now. Let's keep our eye on that one. But most of us don't have that. Our first date is the first patient they see after we've hired them. We can't do working interviews. Like, how would you do like a 2-week interview?
If you're a young gunner listening to this podcast and you want a side hustle business startup, start the associatestest.ai or something or .com or whatever and create a calibration test for all of us dentists looking to hire an associate. So we could somehow maybe not standardize it, but it's a mock. Yeah. Like, hey, go ahead and take this. Just like we have them take culture index, right?
Yeah.
Like, wouldn't it be great? Because Craig, I bet you are the far outlier. I bet you less than 1% of hiring doctors give any kind of clinical.
I'm going to give a shout out to Dr. Alex Morose. He's going to be joining our mastermind. He's in California. He's hiring he's hiring an associate. And I told him, he actually did that. He sat with his computer and good for him. I was so proud of him. He didn't even know that.
So good.
He's not been to a summit. He's not been in the mastermind. He just knew it intuitively. Like, let me check where they're at, because dentistry is one of the things, we had a doctor here who was he had to go, but he was never taking FMXs, doing massive amounts of work in one quadrant. So like making like a 5-unit bridge on the upper left. And then the patient comes back in with a problem in the upper right. And lo and behold, we take an FMX and the whole mouth is breaking apart.
Oh, Jesus.
So I'm a big fan of I'm not worried about people spending money, but I don't want you to have to spend money and then 3 months later or 1 year later have to redo it. Like, just do it right. And I asked him, had you seen this upper left before you did this, would you have chosen to do that? He said, no. I'm like, well, our patients deserve before, so we have a breakdown in our practice where it's like, if it's an emergency, we do palliative treatment, meaning if all of your teeth are blowing in the wind and you sneeze your front tooth out, we'll make you a flipper, just so you have a tooth, but we won't put an implant in your number 9 when every other tooth is falling apart. Patients deserve a holistic treatment plan in our practice, but there are other practices that are patchwork, and I'm not saying it in a bad way. There are good practices out there that exist as emergency only, and thank God for those practices, because I don't want to go in on Saturday to pull a tooth. So I'm happy those practices exist, but we have to explicitly define what are we looking for.
Yes, I'll also say the amount of bandwidth that the practice owner has to pour into the associate is also something they have to consider, because it isn't just let me do this test of 3 or 4 patients and we have enough information to say we align, to then say now you're fully autonomous with no oversight as they integrate into your practice, because new scenarios will come up. This is something we consider when we're onboarding associates. And, there are times where we're like, okay, we have the bandwidth to take on newer associates and we have more people available to mentor. And then there are times where we're like, hey, we need somebody with more experience and somebody that kind of can like initiate and go on day one with more minimal oversight. But the parallel is that there has to be some oversight. And alignment also happens over time as well. And there has to be some sort of frequent check-ins, points where you're going to sit down one-on-one and have communication, not just clinically, but also philosophical as well. And to be able to talk about how's your team going, how is the practice going? How can we improve? And here's my advice on how you can improve, and have that communication. Because what also happens is things are good until they're not. And if you don't proactively have these conversations, you can end up having us thinking, hey, you guys are great. And they have some upset they didn't communicate. And we had all this time, we just didn't ask the right questions.
Erika, as someone who is a human who did not communicate appropriately for most of his adult life, right? I would bottle it up, let resentment form, right? And now as I've gained a little wisdom, I'd see, and honestly, being friends with Craig, and Craig, you kind of forcing me to talk through things. It's really, like you're saying, communication is the antidote for a lot of future problems, right? Like
kindness, clarity is kindness.
There you go. You like that quote right now. That's 2 podcasts you've mentioned.
What winds up happening is the lack of communication is cruel, because you presume that they were going to do X, Y, and Z. And now you have to have this come to Jesus.
Yeah.
Imagine Pete,
things got to be untenable.
Yeah.
And they
Peter
didn't
had
have
a doctor in his practice that had some things that were going on, on a team level. So imagine if you say to a doctor when he joins, you got to be a badass, meaning you got to do $800,000 a year in collections in order to be here. And there's a ramp up to that. Number 2, you got to be really good with patients. And the way we measure that is because we expect you to get 20 Google reviews a year mentioning your name. That's not a big ask. A lot of us can get 10 a month. And then the third thing is you got to be really good to your team. If at 5 p.m. we have to deal with a crying hygienist because you're not being a nice person, that's not going to work either. So people now understand, I know the rules of the game, versus you just presume everybody's going to get Google reviews. And
Let
then
me ask you this,
a year
Craig.
from now, you have to go in and be like, hey, Dr. Jones, you haven't had a Google review in 2 years.
Let me ask you this.
That's unfair.
And Erika, this goes to you too. What things, let's say you have someone coming in for a shadow day. What things in your heart of hearts do you feel like you could train? And what things do you feel like you cannot train?
So, obviously somebody coming in with the right mindset. So when we've seen team members or potential associates come in and, they're asking questions, that to me is an open mindset. So number 1, if people come in engaged, asking questions, that is something that someone has intuitively, that you can't just say, hey, ask more questions, be more curious. You have that curiosity, or you don't. And that's more indicative of that mindset, which is so much harder and longer. Not that you can't, but do you have the bandwidth to fix somebody on a human level? And we try.
Try too hard.
But it isn't, we try too hard. But I would say the curiosity aspect, if they have it already, automatically, it's kind of like a green check right there. The other thing is communication is a lot harder to train on, as long as they have a good foundation of that, of being willing to communicate, because not everybody has the tools to be able to resolve upsets, to communicate elegantly. And we will work with somebody on that as long as they have a good basis for that. The good basis for a good communication, again, is asking the questions. But then during those shadowing days, let's say that person has a different point of view on whatever the treatment methodology would be on that patient, and we counter it, we kind of then in that moment see how are they accepting the coaching and the feedback in that moment, because again, we're here to learn from each other, and you have to be open and willing to accept the feedback, or to potentially be challenged in your thought process. Like, you can't teach that. The actual physical dentistry, what we have seen is that can be taught for somebody that wants to be taught. So that really does go hand in hand. I think that we spend so much time in culture first is because we know that is something that you really can't train. And even for the skills that can be trained, doesn't happen if the culture isn't right, if the personality isn't right, if the mindset isn't right. So they really do tug on each other. So the soft stuff is what matters to us most, which can't necessarily be taught. It can be developed, I think.
When you're talking, Erika, I think of two domains. I think of hunger and integrity. So these are two things you cannot teach. How hungry is somebody, meaning aggressive, or a hungry person will figure out a way to get it done. If they crave more, if they see something more for themselves, they will claw themselves. Like, Erika, you're a hungry person, meaning you see things in the future. And even if you don't have the skills, talents, or bandwidth, or whatever it is, the limiting factor, you will break the barriers to achieve more. That's just hunger. It's just the way God created you, your situation created you. You're just a hungry human. And that you can't teach. You can't want more for someone that doesn't want more for themselves. At the end of the day, you built you, Erika. You got guidance, but you built you. And no one could have built you if you didn't want it for yourself. And the next domain is integrity. I had a doctor that I literally would say, if this was your mother, after the work was inserted, and we're looking at the x-rays, if this was your mother, what would you do? Would you redo it, or would you let it go? Couldn't answer the fucking question. Well, I'm like, no, I'm not looking at the x-rays. If this is your mother, I'm on like the BVIs or something. I don't know where I was, but the patient was upset. I said, I don't need to get involved. Just look at the x-rays and tell me, if this is your mother, are you redoing it or not? Well, I understand. If this is your mother, are you redoing it or not? Well, there's couldn't answer it. That's an integrity issue. Integrity means you do what you say when no one is watching. And if you don't have integrity, nothing can happen from that. Peter, you, me, Erika, we all have high degrees of integrity, and we call each other out. Hey, that's bullshit. You're not doing it right. Integrity is unteachable. Or I shouldn't say it's unteachable, but it's really hard. It's really hard. So hunger and integrity, if you have those, holy shit, the world is your oyster.
Absolutely.
Yep. Okay, good.
Yeah,
sorry, I kind of pulled us off track just for a second, but I think that's an important thing, because, a lot of people listening for this maybe never have hired someone for the first time. Right. And Craig, I think hearing y'all's advice and the missteps potentially, and then the successes, it's like, hey, success leaves clues, like kind of do this, not this, is really valuable, because we get the associate thing in our mastermind. I would say a large portion of our conversations, because everything is predicated on, a lot of things start being predicated on growth. Everyone gets in a mastermind mindset, and then it becomes like expand, grow, do all the things. And of course, the associate model is necessary for a lot of that growth. And so we have these conversations a lot, right? And we've learned a lot, right? From growing our own ecosystems to advising and watching, 6 years of masterminders take on associates and watching them blossom. So I would say we've got a lot of data, honestly.
Yeah. And I can always trace back even in my own situation, like, so you say, a lot of people love to hear that we're still struggling in these domains, but I'll tell you one thing.
Who likes to hear that?
I think just it's more approachable to understand, when you listen to this podcast, you may think that Peter and Craig or Erika, we have it all figured out. No, we have challenges. And
I don't think anyone thinks that anymore, bud.
I hope not. But I'll tell you one thing. So with the major mistake I made recently, and unfortunately harmed patients and had a lot of negative hurt. There was a lot of hurt around it because a lot of these are my friends
around the
and stuff
associate.
yeah, because it was very personal. These are people that I really care about, and we have to
Right.
fix a lot of work and stuff like that. It's very painful. I would do anything to not have that happen. But what happened in this situation? Because I always want to look back and say, how did I contribute to this? And I'll tell you what happened with this one person. And I say it as a precautionary tale for everybody else. A cautionary tale is the reputation of this person was so great. I skipped all the steps that I'm telling everybody on this call to do.
Yep.
All the steps that I'm preaching to you, and that's probably why I'm so passionate, is I'm actually speaking to myself of 2 years. Dummy, why did you skip the steps?
Yeah, and you were very mad at yourself for violating your own guidelines. I violated
my own damn rules.
Yeah.
And, and everybody said it. Hey, shouldn't we start here? Shouldn't we start here? No, we can skip all
His reputation precedes him.
Right. So let's not do this clinical alignment. Let's not do all these things. And my rule now is it doesn't matter. Like, well, number one, my rule is that no one will ever let me hire again here. That's rule one.
Greg, I got kicked out of that role a long time ago, bud.
And I started noticing when Erika brings them on, it just seems to be more successful because Erika has clarity.
My hiring process was
I like sushi. This is amazing.
That was my hiring process. Like, you know what? We had a good beer together. I've
seen that. I remember when we're in Vancouver and you made a new CEO for us. Peter and I are sitting having a cocktail with a friend of mine. He's like, dude, I like you. You're going to be the CEO of Bulletproof. I'm like, Peter, can we go powder our noses in the bathroom? Peter's like, I don't have to powder my nose. I'm like, I have to pee.
I'm ready to sign the contract.
Yeah. He's like, I like you. This guy's this guy's a thoroughbred. And he is a thoroughbred.
This is what's so great and so beautiful about Bulletproof is because we have these not only the experience, but the different perspectives and skill sets. And I think that, Dr. Craig, Dr. Boulden, what you guys do so well is being able to assess like somebody's fit. No. But some of the softer skills, and then somebody like me that comes in is like, I am not violating a business rule or principle. Like I'm not doing it. So when it comes to the harder conversations about, if an associate's like, oh, hey, I see the percentage is this, but I'm requesting this. Now my conversation is I don't go to no, even though the answer is going to be no. Mine is, hey, actually we are aligned and you're getting what you want. Our approach is different, but I'm not changing the rule. This is what I can do. And this is the opportunity that we can have at what we presented, you to. Because people will ask for us to build in special rules. And, for us, we have, 12 associates. Could you imagine trying to keep track of which associate gets which rule applied to them or not? And, that's my skill set. And I think that's the beauty of this. That's the beauty of the group that we have, is to have all of the skill sets and perspectives that you need to really create a good strategy for your practice.
Erika, I've got a slide up in front of us, and I think it's a good summation for sliding right. Fine. And Craig, I know you named the title of this pod, as a fun play on words of like the Tinder or whatever slides right. I don't know. I was never dating in the phase of apps, so I don't know which one you slide right on.
Oh, I saw Grindr on your phone, bro. Don't try to pull the punches. We'll edit that part out.
All right. So Erika, I can go through it because you know me, I like to talk and speak in Bulletproofs with Medium in front of me. So do you want to kind of break down kind of where we are at this point through all the conversation, just to give a nice actionable plan for both associates and hirers? Docs looking to hire.
Can I add one thing before she summarizes? Because it's an important one that I see a lot. I have these two friends and they're amazing dentists. And they say, we need to hire an associate. Great. For what? Well, obviously to do all the grunt work because we like to do the FMRs. What type of associate do you want? Do you want someone? I would never want someone to do the grunt work. Obviously at first it's a great way to start by grunt work, doing hygiene, doing quadrant dentistry, but I want highly productive dentists and I want them to actually take away my job eventually, because but that you got to define what
Greg,
type
you're
of
right.
associate.
That is a thing that is again, this should be added to this chart. That's never discussed. Like, what kind of work do you envision me doing? And so the right answer, in my opinion,
doctors will tell you.
Yeah.
So
I want you to do the broken night guards and the temporaries that break, right?
Yeah.
Which
guess
has
what you'll be
zero
able to do?
production attached. So I can give you 45% of
I'll
zero.
give you 50% of your collections. Your daily responsibilities are numbing my patients before I prep them, and you adjust all my temporaries.
So that's a great question. And I think the right response, and we talk about this in Mastermind all the time, Craig, you and I are very aligned on this. If you want a successful associate, your job in the beginning of hiring them is triage for them, right? And it is actually cannibalizing a little of your workflow so that they can be busy.
Yes.
Job number one is get them busy. Because I tell our masterminders, you can always get busy. I can pick you up and put you in a different state and you will be busy because that's just you. It's not hard to get you busy, but it is hard getting the people behind you busy. Like put down the ladder, put down your hand on the ladder kind of thing and pull people up. So I think it's incumbent upon us to, if you're hiring an associate, do a lot of triage, do a lot of setup, and saying, I want to get, my number one job is to get you as busy as possible doing the things that you like to do. And that to me, if I was an associate, that would be like a warm fuzzy versus the grunt work. But unfortunately, the impetus for hiring is usually, I don't want to be bothered with class 2 composites anymore. I don't want to be bothered with broken temporaries. I wish I didn't have to numb my patients.
That's what we had a masterminder literally say, like, I just want to get rid of all my patients. I'm like, well, don't tell the associate that. You tell the associate and said, hey, it's an amazing opportunity. I've cultivated these relationships for 20 years. I'm going to hand them into your lap.
One question we get, Craig, and Erika, I'm sure you've heard this a lot, and people want to find that Goldilocks time on when is the right time to hire an associate. Like, how busy do I need to be? Erika, I'd love to hear, independent of each other, I'd like to hear your answer on when you think it's an appropriate time to start looking. So take the solo practitioner. By the way, not a group practice, please.
Yeah. I would say number one, that has to go back to doing some soul searching for yourself. What is your vision for your practice? Because you may be busy enough to have patients to be able to sustain an associate. And do you have the bandwidth? Do you want to be busier, have more oversight, have more responsibilities in that set? So hiring an associate is not only about demand or practice need, but also your vision.
Right, take that out of it just for a second, because I know there's some philosophical things and some boxes you need to check, but just give me from a data perspective, looking at the schedule, because we get this question. I've been asked this question.
I want to, sorry, I'm going to push into the soft factor here.
Of course you guys are.
Okay,
I have
but I know, but it's an important thing because let's just say you're my dad or you're Stefan in our mastermind.
Give me an answer. Just tell me.
We will, but I want to caveat it first.
Damn it.
If you are a dentist doing 3-4 days of clinical, you love your life, you're making the money you make, you don't need to hire an associate. You don't need to sell. You don't need to do anything.
All right, fair enough.
Just live your best life.
But let's say you've decided you want that.
Yes.
Okay.
Now,
please just give me the damn answer. That was
Thank you. Yes. Now you can answer, Erika.
Erika, please.
Some of the things I'll look for is if you're scheduled beyond 2 weeks, especially for some that I hear 3 to 4 weeks, and you can't get a patient in for treatment that's been diagnosed and accepting, that's an indicator that you have a patient
emergency
flow.
Or otherwise, right? Erika, you're saying anything.
That's right.
There's no holds for 2 or 3 weeks.
Correct.
Yeah.
That's an indication right
there. That's 90%
of
solo doctors, by the way.
Really?
Yeah.
90% of insurance providing doctors are proud and booked up for 4 months.
All right, let me ask you this. Do you feel, let's say you were moderately busy, but you had a robust hygiene department, right? Would you be comfortable bringing an associate on with, hey, I don't have much work, but I have a lot of same-day dental opportunities available?
Meaning you don't have a lot on the schedule now, but you perceive that you're going to have a lot because you have a lot of hygienists. So a lot of people coming in.
There's a lot of untapped potential because of all these checks I do, but I don't have the time because I'm moderately busy. I'm busy enough where I can't, fully diagnose and spend all the time with patients, but you could go in and harvest a lot of untapped treatment that is needed by patients, kind of thing. Here's
I know where you're going. I know where you're going. Can I add some? I'll add some details or math around it.
Yeah,
so like the studies show that if you have 2 hygienists per doctor, you're busy, right?
Okay.
So let's paint the picture of what Peter's describing. You have four dental hygienists, and you're moderately busy. You actually have an enrollment problem. You're not enrolling. That's 4 columns of hygiene, and you're not busy. Don't think that your patients have all had their dentistry done. You have an enrollment skills problem, because if you have 4 columns of hygiene, that should actually feed, and they're busy and they're full, that should feed 2
That's pretty
dentists.
rare though, for someone to have 4 columns, I think.
I think it's actually not that rare.
Really?
They got busy. You know how, Peter, when we're really, really busy, we watch more dentistry. We don't do it. We're just
you underdiagnose. When you're super busy, you underdiagnose.
Right. So you're crazy. You're checking 4 columns. Every time you sit down to do an 8-unit case, you're being pulled out 4 times an hour. You're like, screw this. Like, you're fine. You're fine. You're running a hygiene revolving door. Right. So you're actually, the hygiene checks are getting in the way of the productivity. So that would be ideal to add that associate, because that associate could not only do cleanings as well and be like a 4.2 hygienist, the 0.2 being, a couple patients a day, but also checking patients and enrolling his schedule, allowing you to sit down and crank out some work.
Yes. Yeah. So there's a halo lift. There's a lift, right? By I don't know if I'm calling it a halo lift.
Well,
or
you're saying
tide.
I am not doing much dentistry, but I have 4 columns. Therefore, I can't get another
your
doctor
personal
busy.
production goes up. There's full appropriate enrollment, so to speak. Not underdiagnosis.
The metric you need to look at. Sorry to cut you, just to make it a clear point. I'm trying to just crystallize it here. Is the number of patients visiting your office per day is more predictive of the associate getting busy than the personal production of the dentist that's there.
So that's why this slide is up here. And thank you. You knew where I was going. This slide is going back to, we're asking the wrong questions as associates, and we're verifying the wrong questions as as owner doctors, hiring owner doctors. Right. And so again, like this slide is like, we've kind of summation here is like, don't focus on the overall earning potential rather than percentages. Again, I think that many conversations have been stopped because of what either party thinks is egregious or abusive kind of thing. Right. Like, I can't give you 35%. I can give you 28. Right. When in the end, it might not matter, Erika. They just wanted to make the 200,000, which was the mean, right?
That's what they wanted.
That was what you want. Erika, I'll let you, I don't want to make, I want you to kind of go through this if you wouldn't mind. I want to kind of put good summation on this.
Absolutely. Just one last thing to add to this conversation before we cap that last thought is, in addition to the volume and the busyness that you have, when you're making a decision to add an associate, your practice does have to have a fair degree of health. And that is, the earnings irritating your profit. A lot of times what we hear in our mastermind group is we have a solo doc who wants to add an associate, and their immediate concern is, well, now the associate's going to be taking over, all of my work, and essentially I'm getting a haircut in entrepreneurial profit because they're now going to be getting, let's say 30% for a round number, of those collections, where that actually trickled down to the bottom line, especially if they didn't pay themselves. So that's another key thing as well is, you have to make sure that you're at least recording that you're paying yourself.
Well, it's not a haircut. I want a clarification because this is an important distinction. It's not a haircut on entrepreneurial profit. It's a haircut on the cost of labor, meaning your cost of labor, because you're taking what you would have made with your own 2 hands and Craig likes it when I say this, bequeathing it to somebody else.
That's very true.
Yes.
Absolutely. All right. Yeah. So
Let me go
we're
back
going
to
to
the other
summarize all of
slide.
this. Okay. So
You didn't see what was on the screen. I had the definition of
bequeath.
Yeah. I may, like it wouldn't shock me as someone who's using it in the wrong context. I've done that most of my life. So, but to pass something on or leave something to someone else. I mean, it's all kind of correct. Bequeathing treatment. All right. Erika, let's go. I'll go back to the slide of summation, and we can put a bow on this awesome pod.
That's right. All right. So here's where to start. If you're a practice owner, before you start identifying that you're going to, hire an associate, you need to know what you're looking for. So you need to get out your list, and you need to write down the things that you want this associate to fulfill. Associates is the same thing as well. Like, you need to know what type of practice are you looking for, and is the practice that you're interviewing going to check all of your boxes. So you just each person needs to know what they want, and therefore you can find it. That's the overarching goal. The other thing is, I like to focus on the culture piece first. You want to make sure that if you have a great culture, that the associate is experiencing that, because all of the other tactical stuff will be much easier to have a constructive conversation, because they will understand the opportunity more so than you just saying that the opportunity exists. Putting the proof behind what you're saying with the numbers, making sure that practice owners, that you are able to provide the data that supports the opportunity that you're saying the associate will have. And then associates asking for the data that will provide some clarity and some comfort to you to know that you are in a thriving practice, and that you will earn what it is that you're seeking. And to have that number very clearly. Don't just focus on the percentage, because the percentage of what actually matters more.
And maybe having some reports, if you're coming from another practice, of like, here's my level of production, like here's my output, what would this equate to in your environment, kind of thing. And that would set the stage, right? It's ingenuous to think that a car that's only capable of, it's only been driving 50 miles an hour can all of a sudden go 100 miles an hour, kind of thing.
How many rooms do I have? Do I have a treatment coordinator? How engaged is the team? I mean, our dentists in our practice, and we've had dentists that take home $650,000 a year on 32%, $650,000. And they think, oh my God, I'm a complete rock star. I could just take this 32% I get here, and if I could just get 40 at Pete's practice, I'd make an extra 80 grand, 90 grand. But no,
they think it's linear
math. But no, the reason why you're doing that is because we have a facility that looks the way it does, and hygienists that are engaged, and treatment coordinators, and a new patient flow, and advertising, and a reputation. So you want to be that entrepreneur. You want to take a thriving organization and do it in there.
Yep. Absolutely. Make sure you also align on your expectations as far as the type of dentistry you want your associate to do, and associates, the type of dentistry you are doing or plan to do. That's important to communicate in advance.
And Erika, this has been a situation, actually, just to give some context, like, hey, I want to do, let's say I'm the hiring dentist and I love veneers, right? If I in discussion discovered that my associate wants to do the exact same thing, that might be hard. There might not be enough to do, right? There may or may not, but it'd be nice to kind of seek the people who want to cover more of a multidisciplinary aspect of dentistry. Hey, doc, I want to do the surgery and restorative. Great. I want to do the cosmetic, right? That's a match made in heaven kind of thing.
Or you've assembled hundreds of thousands of dollars of CE, and you've got a newbie who gets to distill and learn everything that you've learned for free, and you can teach him to replace you.
Totally.
And into that context, a lot of times we have a short-term plan and a long-term plan. And so some owner docs are hiring because for the short term, they want to get the grunt work off their plate because they don't want to do it, or they're too busy to do it. But their longer-term plan is to have this associate potentially replace them as a clinician altogether. And so it will fill the short-term plan of this person's doing all the grunt work and they're happy with it, but not the long-term plan, because then they won't then take over all the other things that you need to do in that.
So this question comes up in the mastermind too, right? Like I had the associate come on in the hire and they asked about partnership, and I'm not ready for partnership. My contention is that thoroughbreds want equity. They want a seat at the table, whatever that looks like. So even if that's an uncomfortable conversation, my advice to you, if you're hiring, would be that you are open to that dialogue when the time fits. And you might be, because you don't know what life is going to present to you. You may have health problems. The practice may do something. You may want to open another location, right? So don't shut it down because you don't want to share your cupcake. You know, we always make that metaphor of the I don't want to get a partner because, you know, then I only have this cupcake to split.
Yeah, the
right?
diminishing pie theory. You can Google that.
Instead of making a cake kind of thing, right? So, and you know, we've been brainwashed again in dentistry thinking that partnership means 50-50. And if we've taught anything in Bulletproof, it should not be 50-50 in my opinion, right? It should be something where you're staying as the founder and, you know, I mean, you can do 50-50. It's just, it's challenging. And I've been in that situation. I was in a 50-50 partnership that blew up. So anyway, don't shut down, you know, thoroughbreds looking for opportunities and equity and advancement and growth and all these things. And if you shut it down by saying, you're going to do my broken temporaries and there's no partnership, there's no path to partnership, then guess what? You're going to be attracting C talent in perpetuity.
And by the way, I always ask doctors that opened up their own practices, I always ask them when they talk about the partnership, the pathway to partnership, and they're reluctant. I said, well, did you have a job as an associate before? I said, they say, you know, of course. Why? Well, if you had an opportunity, what did you have a good associateship? Yeah. Did you ever have an opportunity to buy into it? No. Well, they didn't want that. I'm like, if you had an opportunity to buy in there, would you have still wanted to open your own practice? Most of the time, more than 50% of the time, they said, if I would have had an opportunity, I wouldn't have bought my own practice. People just want to own something. And if you give them the framework, not only will you attract different people, you'll make people different. If you tell someone,
and I think this is what our industry needs, Craig, quite honestly, the non-DSO world aspect of our industry needs more of this hand-holding.
Yeah, because let's face it, we all don't need to buy our own CEREC and our own cone beam. We can get together in small groups like you and I have, and we can share expenses and still compete. It's hard to compete as a solo person, but really groups of 2s and 3s are great. And four doctors get together.
I can also just say, you know, the benefit, obviously, clearly for the practice, but for the patients as well, because when you have additional providers, you know, patients can come in, you know, extended days, or you're not having to close your practice because of vacation. So you're better able to serve your community. And then even for the team, I see oftentimes as well for the solo doc, his team also has to take off coinciding vacations, you know, which might not support their lifestyle. So even this benefits just above beyond.
And I would say that the fear of the cupcake, I would say that in all the instances I've ever seen of someone doing a partnership or selling a little bit of equity, if you fast forward the clock 3 or 4 years, they were making more and the enterprise value of the business was worth more.
Well, look,
after the partnership,
what a good way
than it was.
Sorry, what a good way to, I didn't mean to cut you, Pete, but what a good way to land the plane. We started off, right, with percentage of what? I want to have 35 or 40% of my associate job. I want 45 of what? Would you rather have, now going full circle as owner, coming back to the same thing that you're getting upset at your associate about, would you rather own 100% of a $500,000 EBITDA? Or would you rather own 20% of a, you know, $10 million EBITDA? Like either, you know, it doesn't matter your percent. I don't care what percentage of the practice I own. I care what my distributions look like.
Absolutely. You know, I also want to summarize the last point that we didn't hear in the communication, and just making sure that on both sides that you have time to communicate your needs, your expectations, anything that you might be holding onto. You know, don't let resentment happen. So make sure that you're being upfront with things that you see maybe are possibly sliding the relationship. I mean, all relationships, this happens even in our families and our personal lives. We become comfortable. So make sure that we're having those conversations up front. And also for the practice owners to build that time in, because life happens fast, and easily we have an intention to say, I'm going to touch base next week, and then that gets pushed off, and then that gets pushed off. So just pre-plan time to have conversations, even if you don't have an agenda, and be open and honest. Don't beat around the bush if there is a problem. Just be open and honest and work through it.
And in closing, if you've swiped right and you had a bad date, get back on the app. Not, sometimes we see people who they have one associate, it doesn't work, and they are forever surrendered into, this doesn't work. I'm not going to do this anymore. I'm just going to be by myself until the day I close the doors. And if if you were an active dater like Craig was, right, you have to kiss a lot of frogs before you find your wife. And so
100 of them.
It was a million. I checked. It's 1.6 million.
Hey, there's a graveyard of that, just like the associates.
That wasn't a graveyard. Those are fond memories, actually. I still access those sometimes.
Oh, geez. Too much.
Just edit that out. Where's Jamie?
Erika, thank you for this, because I think this, we've never done it from the perspective of the associate, right? The mindset of the associate, what questions to ask. And so we've always done it from the owner, because that's really what our business, Bulletproof is really focused on, helping and promoting. But I think just finding that match, right? That perfect match just makes things so much easier. Meaning if the associates are coming armed with better questions and knowledge and wants and desire and communication, it takes a lot of the onus off of the hiring dentist, so to speak, right? And they can be cool with, let me show you my data and my financials, and let's talk about what I want to do and what you want to do, as opposed to getting stuck. You want 33%? I'm only willing to do 32.5%. Right?
Yeah, I think you should share this podcast with the people hiring that you think you have hiring in your office, associates. Share it with your classmate or your people that you went to school with, students, seniors in dental school. Get on, make sure you listen to this. This is gold. Like, really take this stuff and go in armed. If you know what we know, you'll be having a better result. It's our job in dentistry to help patients understand what we know, because they can make better choices about their own dentistry. You need to ask these questions. These are really important. So share this, like it, pin it, whatever you have to do with it. And also, if you're considering the summit, we still are open. A couple more spots left, August 8th and 9th at the beautiful Ritz-Carlton Resort.
This should be a breakout, by the way.
Yeah.
But I wish it was, but
Guys, I got to jump.
Absolutely.
Okay. Same.
Thank you, Erika. Thank you, Pete, for putting this on.
Bye.
And
You're
thanks
welcome. Thank you,
for
Erika.
listening
You're
to all of us, and share this and like it and promote it and make sure everybody has a piece of this to understand it.
Over and out. Thanks, everyone.